Hello, my name is Brook. I'm the President and CEO of the Washington Health System. Welcome back for our 8th video in our Friday series where we attempt to answer questions about what's going on in healthcare and questions specific to the Washington Health System. First topic I have for you today is about May, which is the National Stroke Awareness Month. And we just wanted to bring this up as an educational point for everybody in our community. We all know that stroke is a devastating event. And there's an acronym we want you to remember, and it's FAST, F-A-S-T. FAST stands for face droop, arm weakness, speech difficulty, and time. And with a stroke and heart attack, time is extremely important. The longer you put off getting care, the potential worse the outcome. So if you or anybody in your family are experiencing these symptoms, again, this would be face droop, arm weakness, speech difficulty, please call 911 immediately and come in and see us. 911, the ambulance service and our EDs is safe. We want to make sure you come in, get the care you need, and not put that off over concern over COVID-19. This is extremely important. And because it's Stroke National Awareness Month, we wanted to make that point here for you today. So please keep that in mind and take advantage of that service when you need it. Now, to talk about other additional safety precautions, I want to introduce Dr. John Six. He's our Vice President of Medical Affairs and our Chief Medical Officer. John?
Thank you, Brooke. I'm Dr. John Six, Vice President of Medical Affairs and Chief Medical Officer of the Washington Health System. Don't put your health on hold. We at the Washington Health System are about to launch our WHS Safe Care Commitment campaign. And for your protection, Washington Health System is dedicated to ensuring safe registration, safe screenings, safe lobby and waiting room areas, and safe patient care areas and rooms. To learn more, please visit whs.org/safe to learn more about the safety measures that we've implemented to protect you and your family. Additionally, we have added stickers to many of the locations within the health system to promote social distancing, and the Washington Physician Group has installed plexiglass barriers where otherwise plexiglass or physical barriers didn't exist. As we move into the yellow phase, please remember to follow the recommended safety guidelines. These include wearing a mask, avoiding large social gatherings, social distancing, and washing your hands for at least 20 seconds. Back to Brooke to discuss how the transition into yellow impacts WHS.
Thanks, John. I appreciate that update. Now on to our next subject. I wanted to talk a little bit today about the governor moving our region from red to yellow, trying to ramp up our economy and our businesses in the COVID environment. As you know by now, our region went to yellow today at 12:01 a.m. And you might be wondering, what does that mean? And really all it is it's a loosening of restrictions for some businesses and some interactions. So we don't have as much tightening of our market and our economy in this current environment. Now, we're still going to have some restrictions. We're going to still have school closures, gym closures, indoor recreational activities, nail and hair salons. Those kind of things will still be restricted until we get to green. We're also going to have some limitations on large gathering of people. But otherwise, we can start to begin to open things up. The nice thing about moving to yellow is it gives us an opportunity to sort of phase in and start our economy and our business again, while at the same time keeping an eye on what's going on with the people who are being infected, how many people are being infected, and keeping an eye on that in a safe and nice way. Now, we know there are lots of mixed emotions about this. There are many of you out there who want to get back to work and get our economy going immediately, while at the same time, there's an equal number of people who are very concerned about what this means and whether or not we're going to see an increase in people who are infected with COVID-19. Regardless of how you feel about it, we want you to know that the Washington Health System is here for you, and we want to make sure that we continue to be here for you. Now, as you know from some of the past videos, we've started to open up services that were closed and ramping up services that were limited in scope. And we've had a lot of success over the last couple of weeks of doing that, and we're going to continue to ramp those up as we go forward. Now, in addition to that, we're also opening some services that have been completely closed that we haven't to this point. So starting Monday, next week, we're going to be opening the Children's Therapy Center out at the Waterdam Plaza. They're going to be ramping up to about 50%. The patients are going to come through the front door, be screened, and come in for treatment. And then we think in early June, we're going to open the Washington site as well. And we'll be ramping that one up slowly as well. Now, in addition to that, we're going to be opening up Neighbor Health Center, Lab and Radiology, which has been completely closed next week, Monday, to get those services up and running. Now, during this period of time when they've been closed, we've been doing construction over there. We had planned to move the lab service to a different location. We have that ready. So when that opens up next week, Monday, we're now going to have radiology, registration, and lab all in building 2 in one spot in this new location. So it'll be one-stop shopping instead of the previous situation where you had to go to 3 different locations for those 3 services. So there's something new coming with that when we reopen that on Monday. Now, all along, we've been reopening and expanding our physician practices. This is both in the residency and in the WPG. And as I told you last week, Cecil Family Medicine is the only one not open, and that's still true. Those physicians and those providers are seeing patients at the Canonsburg location and will continue to do that. Now, I suspect by the end of the end of May and maybe early June, we will have that site reopened as well. But for now, it continues to be closed. All other physician practices, though, are open, and they're seeing both in primary care and specialty, wellness, sick visits, and preventative visits, and will continue to do so. Now, we're going to continue to push the telehealth visits, the televideo visits, and if you'd like to learn more about that, you can go to whs.org/televisit. But it's simply as easy as downloading our app. You can have a visit with your physician, a video visit, in a safe environment without having to potentially be exposed to other people. We'll continue to push that going forward with you as well. Now, switching gears, want to give a little advice to our local businesses. We know as we've now changed to yellow, you're going to be ramping up and bringing your employees back to work to help our economy and our local environment, and we're all in favor of that. We also want to make sure you do that in a safe way, not only to keep everyone safe in your company, but with our environment as well. So to help with that, our occupational medicine department have created a checklist that you can use to download. You can use that as employees are coming back initially and monitoring them ongoing. You can get that by going to whs.org/OCMED. You can use that ongoing to help make sure you can open safely. In addition to that, occupational medicine also is doing return to work physicals and drug screenings if you need them. And for some professions now who have to use a respirator mask going forward, OCMED is also doing fit testing. And so jobs that might need that would be dental hygienists, dentists, ophthalmologists, and others who now in this new world are going to need those masks. You can get that fit testing done in OCMED. And lastly, if you have any employees coming back who have COVID symptoms, that would be flu-like symptoms, cough, fever, GI issues, shortness of breath, anything that fits the COVID criteria, what you should do is send those folks home and basically request and have them contact their primary care physician for follow-up. Now, if they don't have a primary care physician, you can instruct those employees to download, again, with their mobile device, download our app. It's basically WHS Virtual Care, and they can use that to have, again, a video visit with one of our physicians who can assess them, find out what they need. If they need to have a COVID test, that physician can order it, and they can go to one of our outpatient sites. If they have a primary care physician, they should use that, but we do have that app available if they want it. Now, we still have our COVID testing sites up and running. We've had them going since mid-March. They're both drive-up sites. The one is at Wellness Way, Building 3. It's open Monday through Friday, 8 to 4, Saturday, 8 to noon. And then we have the one down in Greene County at the Medical Arts Building near the hospital. That one's open Monday through Friday, 8 to 4. Those are still available. You still need a doctor's order. Fax it into us, and then your employees or the patients drive up and we get that done. Now, I want to give you a little heads up. We're talking about potentially closing those sites down and relocating them to some of our other facilities. That hasn't been completely finalized, and we don't have a done decision on that. So we'll have more updates for you when that happens. But for now, those sites are still up and operational, and you can continue to use them. And for all the individuals and our existing patients out there, as we ramp up services at the health system and in our counties, we want to make sure that you're safe as well and you continue to be safe. So when you go out in public, please use a face mask. And when you come to our buildings for services, out of respect for our employees and our team members, we're requesting you bring a mask and wear it while you're here. It's the safest thing for you and for our employees. Our employees will wear a mask to keep you safe, and we're requesting you wear a mask to keep us safe. We'd also request when you come here to exhibit and perform good social distancing. So when you're in our lobbies, registration, waiting rooms, those kind of things, make sure you sit apart from people. And remember to use good hand hygiene. We want to make sure you're safe at all times. So that's it for our 8th video. I hope you found it useful and good information. I appreciate you taking some time to spend with us today to watch this video. Now, as we return to normal, instead of doing these videos weekly, we're going to start doing them bi-weekly. So our next video is going to be Friday, May 29th. Until then, stay safe.